Also here in Seoul, the standoff between doctors in training and relevant government officials remains intense, with patients praying for a quick resolution. Our Eun-hee has the latest.
The nationwide doctors' strike continued for a third day on Thursday, with doctors protesting against the expansion of South Korea's medical school quota by 2,000 to over 5,000 starting in 2025. Over 9,000 trainee doctors, more than 74% of the country's interns and residents, had submitted letters of resignation as of 10 p.m. Wednesday, though none have been accepted. Out of these, over 8,000 have not shown up for work. The total number of leave of absence letters from medical students announced on Thursday surpassed 11,000 nationwide, which is more than 60% of the total number of medical students. About two-thirds of trainee doctors have walked out of hospitals, meaning medical services have been disrupted and patients are being affected. For example, at Samsung Medical Center, one of Seoul's 5 major teaching hospitals, 30% of operations scheduled for Wednesday were postponed. Surgical procedures at the Severance Hospital were less than half of the usual amount. The focus of large hospitals has shifted to prioritize critical and emergency care, causing outpatient appointments to be postponed, while some patients recovering from surgery were discharged earlier than scheduled. The number of complaints reported increased to almost 150, with 44 of those over surgery cancellations.
My father had emergency surgery for colon cancer, so today I came to check on the results, but I received a text message asking for my understanding, saying that appointments might be delayed due to the high number of patients.
The government has also issued return-to-work orders to the majority of the doctors who have walked out, and are asking to discuss the issue with them. In a briefing on Thursday, the government stood firm on its plan to take strong measures, including license suspensions and legal action against those who do not return to work immediately.
The government has decided that at least 2,000 more doctors are needed as soon as possible, taking into account factors like the training period, growing medical demand due to the aging population, and other opinions from different parts of society.
The official added that by the year 2035, around 32,000 doctors aged 70 or older will retire, which based on the current capacity exceeds the number of new graduates over the next 10 years. To this, junior doctors are demanding the government backtracks on the plan to increase the number of medical students, while the Korean Medical Association calls its return-to-work orders amount to suppression. Eun-hee, Arirang News.